everyone. Thank you for joining us on yet another weekly session or bi-weekly session of our Native Strong Town Hall with Dr. Lyle Ignace of the Gerald L. Ignace Indian Health Center, located on 930 West Historic Mitchell Street on the south side of Milwaukee. For those of you who have joined us before, or if you're a new attendee, we always enjoy questions. We love questions. So if you're tuning in via Zoom, if you've dropped in here, you can drop in a comment or question in the chat bubble, which is located at the bottom of your screen. If you just kind of hover around down there, or if you are joining us via our Facebook live stream, you can just drop in a comment there, and we will be moderating those throughout the session. But don't get antsy, don't get too antsy. We do try to wait for all the questions to be answered or brought to our attention at the end of the session. So stick around if there's something that really is on the, that you feel like you want to have answered. We got our good friend Mark back with us this week. So welcome back, Mark. Thank you for being here. And with that, I'll pass it right along to you. Thank you.
Edwin Abuju and Maganaduk, not away Benazi indigenous cause, Nemando them, Anishinaabe and Dow, Neopodin Donjba. American name is Mark Denning, and Sturgeon clan. Born in Neopit, Wisconsin, descended from 6 tribes and 2 European. It's good to be back. I'm just spending a little time on that introduction. And also, before going too far, very important to all of us, a good and proper thank you to all of our veterans that are out there. We have several of these flags, fortunately and unfortunately, in our home. Representing the veterans in my family and thinking about them. And for all of you veterans out there, good prayers and thoughts to each of you. Thank you for all what you have done. We are saddened by the passing of your friends had you been in places where lives had been taken, and a good continued mental health, especially to those veterans who served in our Middle East. We've lost far more veterans to their own hand after their return than we have lost on the battlefield. And that mental health piece is very important, not just for them, but for all of us to be aware of. So veterans, thank you for everything, for lots and lots of different reasons. And a good shout out to those of you history folks that continue to tell that story of World War I, the disproportionate veterans that volunteered for service, resulting in the citizenship of Native people. And there's lots of editorials about the good or bad of all of that, but it happened, and we're here. And we need to help protect ourselves, our liberties, and also our lives. And that is my segue to why we're here today. There's a lot of disinformation about there going on, especially on social media platforms. Unfortunately, in Wisconsin, on sports media platforms as well. And it's not just about one person. It's about folks that believe that information and spread it. So with that, and getting in front of disinformation, native to native conversations, I want to send this over to Dr. Ignace and say welcome to each of you, either live or online, and thank you for being with us. So a good, happy Veterans Day, everybody, and thank you for all that you have done, veterans. Dr. Ignace, over to you.
Thanks, Mark, and thank you for those good words. I know it is Veterans Day, and it's important to recognize and honor and support our military. As Native people, we are certainly have lots of family members across our nation that are involved in all aspects of our armed forces. So shout out to our military people. So this week kind of marks another historic point in this pandemic. As we all know, COVID vaccines had been approved for emergency use authorization for children 5 to 11. And this week we have seen a great deal of children coming in and getting the vaccine. And I know a lot of people have questions, and we're probably starting to hear things about vaccines regarding 5 to 11. And, you know, it's going to be a point where we will all need to look at our family as a whole and consider vaccinations for everyone. And now that 5 to 11, parents need to know what to expect when it comes to vaccines. So that's what this slide is here. Just scrolling through all of the information that's out there right now. First dose, second dose. So Pfizer has been approved. It is at a reduced dose than the adults get, but here are the expected side effects from first dose. Obviously, site injection soreness, much like adults get, but fatigue, headache, muscle pain, diarrhea, chills, joint pain, fever, vomiting. These are kind of the first symptoms that to be expected. Some are mild, some don't get anything. Just like adults, the range varies, but much like what we have seen and experienced ourselves, fatigue, headache, muscle pain, these are the primary ones. After the second dose, fatigue, headache, muscle pains, chills, fever, diarrhea, joint pain, vomiting, pretty much similar. So whatever had occurred during the first dose, anticipate that this will also occur in the second dose. Now, as a result, we've seen a huge influx of calls. Children are now being brought in by their parents. So, and I know there are concerns, comments that are being made regarding myocarditis. Now, what I will say to this is that what we know, getting COVID in of itself has a high risk of, the individuals have a high risk of developing myocarditis in of itself from the virus. Now, is that possible from the vaccine? Now, in the initial trials that came out from Pfizer, now granted, the number of individuals that were enrolled in the trial were about 2,000 individuals. Now that is a much smaller sample size than the adult enrolled trials that Pfizer undertook. And so with a smaller group, a smaller sample size, you do run the risk of not seeing all of the potential side effects. And that is possible that the rate of myocarditis that was not seen in the trial may actually do occur. Problem is, we don't know. There isn't enough information or data out there to actually quantify what individuals' risks are. Now, I'll be going through a lot of slides today, and the focus will be in and around the vaccine for children's 5 to 11. Now, I had presented this information, and this was published by the CDC. I had published this, and so what we're looking at is almost 2 million children in the country from 5 to 11 have been infected with COVID. Now, up until Delta, they were probably the smaller portion, but since Delta, that has sharply increased, and I think much to be expected. 10.6% of all cases nationwide, and a population that is only made up 5 to 11 of 8.7. So there are a lot of children getting COVID. Now, I mentioned last time we talked about hospitalizations. Now, hospitalizations, despite there being a lot of infections, hospitalization rate is extremely low. CDC put out that 30%, about 2,500 kids were hospitalized without having any underlying conditions. The flip side of that is about 70% of kids 5 to 11 that were hospitalized, or 5,800, had at least one underlying condition. Now, what's unfortunate is the CDC did not actually offer what that one underlying condition is. It could be asthma, it could be, asthma, maybe a kid has high blood pressure, maybe it's diabetes, type 1 diabetics, perhaps it's more complicated underlying conditions such as either respiratory or cardiovascular, maybe cancer, transplants. And so, these are the types of guiding conditions that would certainly help not only families, but, in particular, providers in kind of identifying underlying conditions and who's extremely at risk, for hospitalization. Now, I had mentioned this multi-system inflammatory syndrome in children, MIS-C. This is going to be a topic that's going to be discussed. It is an inflammatory reaction that occurs in our system, in our vascular system, in our immune system. It is an overwhelming response, inflammatory response, and as a result, a lot of our body organs get recruited and wrapped into this inflamed state. Now, that could be the heart, lungs, kidneys, our brains, eyes, our skin, and our GI tract. And so this is important because this is one of the leading indicators as to what many of the health experts, including the FDA, CDC, are letting people know what the vaccines for kids 5 to 11 is trying to prevent. Okay. Now, as I mentioned, almost 2 million kids to date have gotten COVID 5 to 11. Now, CDC's come out, a little over 5,200 cases of MIS-C have been reported, and a good portion of these individuals that are diagnosed with MIS-C are admitted to the hospital and into the ICU. And so this is important not just for providers to recognize this occurring in kids, but it's also an important reminder that these conditions that do occur do involve respiratory as well as cardiac compromise. And so in that requires a lot of support, a lot of IVs, a lot of even medication support to help individuals get over this acute response. And so that's why the individuals that are admitted do require ICU, because these medications need to be monitored, they need to be adjusted either from minute to minute, hour to hour. So there is a lot of care that goes into cases. So now I will say 5,200 cases out of almost 2 million COVID cases in children. So it's a rare occurrence, but it is seen and it is associated with COVID. And I think that's the take-home points that people need to be aware of. Outside of this pandemic, this was even a rare event because it really didn't happen. But since the emergence of the coronavirus, there obviously has been more and more documentations, more kids are being seen with this. And the vast majority actually with really good supportive care can recover and do fine. Now, I think what's important here is when we start talking about very specific clinical situations of COVID, and in this case, kids, MIS-C, what populations are we actually seeing this in? And so MISC, when we start looking very specifically at race and ethnic populations, there's a very high percentage occurring in the Black population, the non-Hispanic white, Hispanic population, and less than 1% of all cases of MISC are occurring in natives. So while, again, taking all of this information in, having to understand the impact and the ramifications, and start looking at how we can strategize in our approach to not only reducing COVID, but also limiting the risk of the MISC cases. Now, what's interesting is the median age for this diagnosis is 9 years of age. Half of all the cases of MISC are between the ages of 5 and 13. So this again is just a reminder with now the emergence of vaccines being available for 5 to 11. Again, we need to look at where is the biggest impact that this would benefit. 98% had a positive test for COVID. The remaining 2% had contact with someone with COVID-19, even though they may have been negative. They had an association or close personal contact with someone who had COVID, like in the household. Now, what's interesting is 60% of reported patients are male. Most of the cases, 60% of all cases, are in our sons, our young boys. And so this, again, is important to understand how this is all being presented. This is straight out of the CDC and really is looking at the association between COVID-19 and MISC. Now, in blue is the MISC cases, in the dotted black lines, the COVID-19. So you can see with the surging of COVID cases, there are surging cases of MISC. Now, what's of interest of the last couple weeks is the MISC cases are nearly non-existent. Now, I'm not saying that it isn't occurring, and maybe it has, but not to the extent of being admitted to the hospital. There may be cases, but they're not admitted. Most of what I'm presenting to you are cases that are actually admitted to the hospital. So it could be occurring, they're just not being calculated as being hospitalized. So now, as I mentioned, this is a bit of an update. 5,500 cases and 48 fatalities have been reported in regards to this MISC as a cause. So this is not a condition, a benign condition. It does have some real risk, and it does require a lot of supportive care if it is in a full case of this syndrome. So it's important, again, looking at these numbers and how the data is looking, it's important to apply this to your own family, okay? Now, what's been interesting is we get a national look at MISC. I just been browsing through health departments' websites looking for information regarding this. Wisconsin just put out some information several days ago. Michigan has been tracking this for a while. And so here is Michigan data, looking at it from a state level of how many cases have actually been diagnosed in the state of Michigan. 176 cases. Associated deaths, 5 or fewer. I don't know what that means. If there's been none or one, it's not specific. Cases admitted to the ICU, 71%, which is a high number. That's a high rate. And again, as I mentioned, this overwhelming inflammatory state causes a lot of different changes. But, you know, specifically, it could lead to low blood pressure. It could lead to cardiac problems, respiratory problems, kidney problems, GI problems. And so, like I mentioned, it takes a lot of support to manage individuals who get this. And it does take adjustments minute to minute, hour to hour. We look at the age demographic, 0 to 4, 26%, 5 to 10, 40%, greater than 10 years of age, 33, 34%. In terms of racial and ethnic demographics, the African American population has the highest, along with non-Hispanic whites. Males, as I mentioned, in the state of Michigan, males almost 60%, 40% female. So again, looking at it from a national, now down to a state level, hopefully we'll be able to get some information regarding Wisconsin. There have been reported cases here in Wisconsin, and I'm sure that information will be published hopefully in the coming days, if not weeks. Now, what's going on from a more broader macro level when we start looking at what's occurring on a global level? We see left to right, on the left-hand side, we see the bar graph. There has been an uptick in cases. And the question is, where is this occurring? Because here in the United States, the trend has been going down. The trend has been going down. So that increase is not associated with it being related, even though we may have the highest numbers of any other region or country. Our numbers aren't increasing. In fact, they're actually flat. So what is causing the uptick globally? And it is occurring overseas in Europe, where 10%, there's been an increase of cases in Europe, and particularly a couple countries. I believe Germany is one. Another country is Russia. Russia is cases have skyrocketed recently. So we look at what's occurring in the United States. Where are the cases here in the United States? I set up two tables here of states and the numbers. This is the number of cases in the past 7 days. So on the right-hand side, you see what it was 2 weeks ago. The one column that is adjacent to the United States, that is as of yesterday. So we've seen these adjustments. There are states that are surging, like California, Michigan, Pennsylvania. And as you go down, you start looking at where Minnesota is, Illinois is, Wisconsin is, and Indiana. So a lot of the upper Midwest states are starting to surge. I'll talk a little bit more about Minnesota. But these are the trends that are occurring. We see that Florida has dropped down, and so, you know, different regions of the country are experiencing much broader shifts and reduction, as well as some states with increase in surging numbers, and as overall the numbers have remained relatively flat. As far as hospitalizations are occurring, again, with the number of cases, there's the number of admissions to the hospital are starting to recede. Now, I will say that we do offer boosters for Pfizer. We do offer boosters for Moderna. We are offering primary series to kids 5 to 11. And that's going to be important because 5 to 11, we will need a parent to be present to give consent for giving shots. So Pfizer booster, please feel free to call us, and we will be happy to set you up for a date and a time for either yourself, if you're unvaccinated, or your entire family and children. So please feel free to do that. Now, shifting gears a little bit, and this is looking more specifically to Milwaukee County. Now, as you remember, we've had several campaigns to get our Native community vaccinated. We did it with Pfizer and Moderna, and we had a really good success. And we've been able to continue that since last year, or I should say, since February or March, early this year. And there's been a tremendous acceptance of getting vaccinated in the Native community. As of this week, in probably the last 3 weeks, the Native community here in Milwaukee County has the highest rate of receiving a first dose. First dose essentially means you're going to get fully vaccinated with the second dose. But this is really important to see the effort that has been put in to get our community vaccinated has paid off, and we're seeing the acceptance of getting the vaccine, and now we have the highest rate of all racial and ethnic populations here in Milwaukee County. So that's really important, and this audience needs to know that. COVID-19 cases in the last 30 days, and these are heat maps looking at comparisons of cases to first dose administered per 100,000 K residents. As you can see, the cases, there's smattering of cases all over Milwaukee County. The more deeper red means more cases. The lighter the shade of red here, the fewer the cases. So you can, wherever you may be here in Milwaukee County, you can see where that relates to where the cases are occurring. Now on the right-hand side, again, another heat map. The higher penetration of vaccines given, first dose vaccines given to the residents of Milwaukee County, you see that there are very high rates of vaccination, and you see very low rates. And you can, looking at this map, you could see exactly the demographics of where the vaccination rates are the lowest. And so there are correlations between vaccine rates to case rates. We know this, we've seen it, and this is obviously demonstrating that notion. Again, looking at a heat map, confirmed cases COVID-19 over the last 4 weeks in children 0 to 17. That is, if you look specifically on the left-hand side, we know there's a lot of cases. We know this region of Milwaukee County has a low vaccination rate, and again, we see the more densely red area that correlates with a higher rate of cases. We're seeing this in the very specific area of Milwaukee County. Percentage of tests that were confirmed positive, 0 to 17. Again, this is highlighting what has been over the duration. And so we see there are very specific areas. These are the more densely populated areas of Milwaukee County. So you can see where COVID has impacted our community the most. Now, with this cases 0 to 17, how about hospitalization rates when it with the same age group? Again, we're looking at areas that are probably the most densely populated. With the higher rates of COVID, we're seeing also higher rates of hospitalization. So that's just a correlation that I just want people to be aware of. Now, if we look at what's occurring most recently with hospitalizations, this is a tracker, weekly hospitalized cases of 18 years of age and younger. And again, you can just see the correlation of the surge of COVID and the most recent surge of Delta, starting in July 4th and on. You could see as the cases of COVID went up as a result of Delta, so did hospitalizations. As it's starting to go down, we're starting to see that downward trend as well. And this is really just looking at the total cases of tested individuals from March of 2020 to November 2nd. And this again is looking at what age group is the most significantly impacted by COVID. So if you're just looking at browsing this, it has all of the age groups 0 to 18. Looks like, kids 0 newborns to maybe 4 or 5 year old. They are at the lower end of cases. As kids get older, we see those numbers starting to gradually go up and then be more consistent with the general population of adults. So obviously older teenagers, higher cases, younger, fewer cases. So that's just a quick snapshot as to how these cases are unfolding by age. I wanted to present this because this is a bit interesting. So if we look at the confirmed cases of 18 years of age and younger, we can start looking at, age, demographics, male to female. We can look at race and ethnicity. Now, when I look at this, the one thing that I really focused in on is what is occurring in the race and ethnicity group. Now, we see that there are 3 main categories this is Milwaukee County. So we see the African American population, the non-Hispanic white, and the Hispanic population all having very high rates. What I don't see on this is the Native population here in Milwaukee. Again, this is 18 years of age and younger. I don't see purple on this map, which is actually quite remarkable. Now, this may change, but as far as I can tell, even if there were intermixed behind another overlapping shade color here, the number looks to be extremely low, which is good news for our kids. What's going on here in the state when we look at who have the rate that has completed the vaccine? Now, this is looking at 12 years of age and older, 55.5%. We look at just the adults 18 and older, we're almost at 66% vaccination rates by total population. If we look more specifically at race and ethnicity, we have these varying degrees. We see the Native population, almost 53% of the adult Native population has been vaccinated to date. So quick snapshots. Again, looking at the nation as a whole, over 191 million individuals have been vaccinated, and this represents about 58% of the total population. With the addition of 5 to 11, obviously they're going to be rolled up into this number as well. And so, this number may start taking a higher bump in terms of percentage and rates. In terms of vaccines, so, obviously with everything that's going on right now and the current effort to implement mandates, especially the vaccine mandate, we've had kind of several bumps. One, here in late September, there was the current administration's authorization for the vaccine mandate for federal institutions and contractors. We saw a bump up in the vaccination rate. Since then, that has kind of trickled down. And then what has occurred most recently is obviously these vaccination mandate dates are coming due. So there's been a bit of a surge in that, but also a surge in younger people getting vaccinated as well. So there's an intermix of vaccines here, plus we have the addition of boosters as well. So hard to read exactly why there's such a significant increase, but I suspect several things. Boosters is one, kids are one, as well as deadlines on mandates is another. Now, I had mentioned Minnesota. This is looking at the 3 states in our region here: Michigan, Minnesota, Wisconsin. Michigan and Wisconsin. The number of cases have been relatively stable. They've kind of at this plateau point. I highlighted Minnesota because the trend in cases, they have now over 10,000 cases, 10,140. In the last 2 weeks, there have been 1,031 cases, on the average 516. So this is a huge increase in COVID cases in the state of Minnesota. And these are the native population, nearly quadrupled the number of cases from 2 months ago to where we are now. So these, if people are from Minnesota, you know, are seeing this, hearing this, please tell me, you know, let us know what you're seeing in Indian country in the state of Minnesota, because these numbers have significantly changed, in a complete change in impact here of a lot of families. Looking at the rate by population, 11.2% in Michigan, 17.7% in Wisconsin have gotten COVID, 13.4%. But as I mentioned, Minnesota's native communities are significantly getting impacted by this right now. Here back in Wisconsin, as of November 10th, there was 3,370 cases. Just when we thought, at least I thought, that the numbers were trending downwards, we've had a kind of an uptick in the past week to 7 days of gradually increasing numbers, and now we're averaging 2,453. So just when you thought things were looking good, better, things have flipped, and they flipped pretty quick. In terms of racial and ethnic demographics by case rates, natives are still have that second in case rates, second in hospitalization, and have the highest rate of fatalities per 100,000 here in the state of Wisconsin. Again, because been talking about children so much, the focus is going to be on children here. So looking at this, 18 years of age and younger, native population is number 1, and they have the highest case rate here in Wisconsin. Now, I will say, over the last 2 to 3 weeks, that surge in cases is starting to go down, as highlighted by this orange line. The trend is going down. Higher cases in young kids, does that necessarily mean higher hospitalization? And as you can see, this orange line has been flat, 0 cases. And so when you look at, in comparison to other demographic groups, the African American, Hispanic group have higher rates than the native population. So hospitalization rates have been low, despite having the higher case rate here in the States. And just to end this, looking at the demographics overall for the state of Wisconsin, where are they coming from? Again, we're looking at 10 to 19-year-olds as being the number 1, 30 to 39-year-olds being the number 2 spot. And just looking at the percentage of cases by age group, we have the lowest case rate by in our elder population, with the higher case rate in the 10 to 19 with 15.6%. That opposite, that flips when it comes to hospitalizations. Again, as I mentioned before, high case rates in younger kids does not translate into higher hospitalization rates. And and as far as fatalities, over the last month, there have been no fatalities in children less than the age of 20. So with that, I'll turn this back over to you, Mark and Jeremiah, for any questions or comments or follow-up.
Dr. Ignace, just kind of a reminder for everyone that's watching that you have a chat feature on this program, and you can go to that and write in a question that you have. So here we go with a few of them, and I got them at the Gerald L. Ignace Health Center Powwow, right? So it was pretty good, a good time, and it was very fun. But there were some concerns there and folks that usually don't get to see a doctor. So 3 things, here we go with the first one. Someone had COVID-19 before the vaccine and has tremors. And their question was, and again, they're not kind of participating in that medical scene like they should. Is that something that long-term COVID-19 folks have been seeing, or could this be something different? And the tremors are continuous; they're always there on one side of the body. So just, you know, not trying to ambush you with medical advice, but we do have long-term folks out there. So that's a specific question, but in general, for the long-term folks that do tune in here, and they do. Any advice for them after you address that tremors piece that might be of concern to you?
Sorry, I was on mute. So obviously, individuals that are kind of deemed long haulers, there's going to be scenarios, and because this is such a new phenomenon that is seen in the medical community regarding, and very specifically, COVID and the aftermath of COVID. By far, the vast majority of individuals who do get COVID do fully recover. And then there are individuals, a very small portion of individuals, that do have these underlying nagging physical ailments that just continue to persist. Now, tremors, although not completely unheard of, is pretty rare. And so I would certainly follow up with your primary care physician and start looking for possible solutions, even subspecialty care, either a neurologist or an infectious disease specialist that may help guide and may have, you know, maybe an early treatment option, not for COVID, but with the tremors that may help kind of ease some of these ailments.
So if you're listening out there, would you say, Johnny, you know, get yourself to the doctor? All right.
Mhm.
I don't think you can solve it yourself, or say, I know what this is about. So that's one. Second question comes from mom and a dad. Kids are back in school.
Mhm.
When they come back with the sniffles, the cough, little Jill, little Johnny, as you like to say, is there something that is different about COVID-19 that they could be looking at? Or when do they come in for that kind of testing to let them know, hey, this is what we're dealing with? Because a lot of kids not having their masks, they're outside playing. I mean, you get it.
Yep.
I mean, when is it something and when is it COVID-19?
Sure. So, you know, I as a parent myself, I have little ones that are in elementary school. So, I mean, we all keep a watchful, vigilant eye on our kids, especially even before the pandemic, when they would come home and they'd have runny nose, cough, and sneeze and all that. And you obviously know they have a cold. And that may very well be the case even right now. Now, I will say there is the emergence of RSV right now. It's starting to pop up. And so, and then we have obviously the flu, and then we have the general cold, all of the cold viruses that are going to be coming out as well. Now we have to be mindful of all that, plus in addition to COVID. So how I would approach this is knowing your kids and how they feel. I would think having a fever, having stuffy nose, having the malaise or fatigue or tiredness, really out of the blue. I think that should be kind of, make your ears start ringing here, and really consider this to be COVID related. Call your primary doctor. You could do that. You could go to your local drugstore and get an over-the-counter test for a quick screening test that you could do at home. That would probably be the quickest. There is a cost to getting those over the counter. So depending on what you can and can't do, or even having access to your primary, call them, let them know these are the symptoms. I suspect, but I don't know. More than likely, they're going to get tested. Depending on the symptoms and the test available, we could do a rapid test, which could tell you in about 15 minutes whether your suspicions were right, or if it's negative and we need to do a confirmation. So, but even so, if your kid was ill, sick with a fever and cold symptoms, you would probably keep them home anyway. So it may be the best opportunity to just to be on the safe side to get tested.
So the third and last question, Jeremiah, you may have one that you've been hearing at the clinic. This one comes from the powwow, and those elders are quite smart, I will say. When it's free coffee, you can guarantee yourself that there will be an elder section sitting by the coffee pot, right?
Sure were.
So this is to all the elders out there. There's a lot of confusion around when advice comes towards our elder population, meaning for some of our tribal councils, elder begins at 50. For some of them, it's 55. For some, it's 60, 62, 65, yet others 72. When our elder folks, or those in the older population, hear the voice that says, hey, get yourself a booster, our elders should get a booster, what age are we talking about, and when should they go in if they're in that place to get a booster?
Yeah, you hit it right on the head on this one, because this is more cultural, right? There's applications to modern medicine to everyone, and then there's also how does this apply in cultural adaptations to the Native community? Like you said, elders can be defined by 50, 55, 65. Now CDC recommends all individuals 65 and older are eligible for getting a booster. Now, this is what I would suggest. Being over 50, let's say you do have a underlying condition. Let's say it's just high blood pressure, or maybe you have cholesterol. Maybe it's asthma. If you're 50 and you come to me and say, hey, I am an elder by our kind of traditional ways, I don't have a problem recommending that booster. If that individual wants a booster, I'd give it, not a problem. 50, 51, 59, 64. If an individual wants a booster, I would not hesitate to give it. And what's on the horizon, following up to this, what's on the horizon, Pfizer is now, and Moderna is right on their heels. They will be submitting pretty soon, if not already, that all individuals, regardless of underlying condition, be eligible for a booster. So it's coming, but knowing how vulnerable and in terms of rates of infection, I personally, as a provider, if I was your provider and you came to me, you were 51 and said, hey, I'd like to get a booster, I would not hesitate in doing that.
So most the questions I was getting were, and you kind of touched on it, but maybe if you want to hit that again, as far as the clinic offering vaccines to 5 to 11-year-olds, what that process would look like for a prospective patient. And then just real quick, I know, a lot of schools in the area and or nationally, it seems as if lately, even in the past week and a half, those emails of, so-and-so's kid is, got COVID. So now, half the class might have it. So, here I've seen cases of classes going to virtual for, 10 to 14 days. And, we're only in, kind of the beginning of November here. Do you see this as kind of a harbinger for another kind of rough winter when it comes to not just COVID, but COVID in schools, and what that could look like for classrooms? Parents who have kids that might have to be now going back home for a little while to do the virtual thing again. So I'm just curious on your thoughts on that. And then I guess, I just mentioned again the offering of the clinic for 5 to 11-year-old vaccines. And then I'll just leave you with the final word.
Yeah, so obviously this is a big concern going into the fall months and winter months here. Last year, where we had a lot of home online teaching, young people, parents staying home, a lot less in-person interaction. Now, with school back in person now, kids, college students, yes, there has been a surge in uptick in cases. Now, what the trend is, at least what I'm seeing right now for kids less than 18, is that the rate is starting to go down. Now, we kind of hit a plateau right now, and right at the point of right before Thanksgiving. So what does that look like moving forward? Now, typically before the pandemic, my observation of the flu, really, I know it starts in October, but my sense it starts more like after Thanksgiving. That's where all of the interaction, family get-togethers and such really start to happen. And now, what would be really interesting right now is we're just starting to see the emergence of RSV. Yes, there have been cold-related viruses out there right now. I have not seen a flu case yet. It may be too early, but like I said, I really don't see, at least historically, flu cases after Thanksgiving. Now, last flu season, flu and cold season, those numbers had markedly decreased across the board, across all ages. The number of cold cases, viral cases were markedly diminished. I anticipate that to be very similar to what will happen. And I think what we will see in terms of trending, not right now, but what we will see come Christmas, New Year's, that may be the trend moving forward. And that will tell us as it relates to other things, other colds other than COVID. Now, as far as what's occurring right now, and I didn't really touch on it this week, but I had in the past, is Merck and Pfizer with their antiviral oral medication treatment. if the safety and efficacy are really there, and Pfizer stopped their clinical trial based on such high success of the medication in reducing hospitalization and fatalities, they actually stopped it because it was working so good, or they had seen such great. It became unethical not to treat people in the other control arm that were not getting it. So if that's the case, if Pfizer and Merck have very similar safety and efficacy profiles in reducing hospitalization and fatalities, once these get presented to the FDA and the CDC, and there is an emergency use authorization to not only prescribe it, but to start giving it, this pandemic may see its way out into an endemic, which is a step below pandemic, endemic. It will be a game changer. And so that could be a game changer in all facets and trends of virus causing cold-like symptoms. So these next, I would say by Christmas, we will definitely know what the trend is going to be looking forward into the winter months, January, February, March, of what's going to happen, not just with COVID, but also with the treatment of outpatient treatment of COVID, as well as trends in school age illnesses as well. So there's going to be a lot coming forward, and it's actually encouraging. I'm encouraged by what's coming out right now, especially with the oral medications, which could be a huge difference in not only getting COVID, but there's actually a treatment for it as an outpatient. And so that's going to be a marked game changer across the board. So, but until that happens, looking at what's available right now and the vaccines that's been authorized for 5 to 11, families will need to seriously look at the importance of not only prevention of your family as a whole, but looking at prevention for your kids and your relatives. And the holiday season is coming, and this would be a really good time to be able to look at preventing COVID from happening in your house. So until next time, everybody, be safe and stay strong.